we need to somehow understand human behavior and how to communicate healthcare measures better, because it is very disturbing that so many people acquire HIV in an area where we know exactly how it's transmitted. Considering how much we understand about HIV, we have about 50,000 new cases of HIV in this country per year. In 1985, we had about 50,000 new cases. So while the population has gone up, we have not done a terrific job at reducing transmission in a country with a high literacy rate, with great communication. We need to somehow understand human behavior and how to communicate healthcare measures better, because it is very disturbing that so many people acquire HIV in an area where we know exactly how it's transmitted. I wish I could tell you what the solution was, but it's very hard to change human behavior. I think a good example is syphilis. Syphilis, in many ways, is a much easier disease to deal with than HIV. There's a blood test that's simple, that everybody understands. Once you recognize syphilis, 1 shot or 3 shots of penicillin is cured, and yet we have raging epidemics of syphilis in major cities in the United States. So if we can't cure syphilis, we can't eradicate syphilis, how are we going to eradicate HIV? What's the problem with syphilis? It's education. We know how it's transmitted, we know how it's treated, but people don't protect themselves during sexual intercourse. They don't get diagnosed early, they don't go for regular checkups. It's a human behavior and access to care problem, and it's one that, again, we have the resources to fix in terms of getting people access to care, getting them to change their behavior to be more risk averse about their health. That's a much more complex issue that I don't have a good answer to.